Hello, everyone, and thank you for joining today's webinar, Getting Ahead of the Health Plan Transparency Rule, Turning Compliance into a Strategic Advantage for Your Clients. This webinar is brought to you by Healthcare Bluebook. Healthcare Bluebook's goal is to protect consumers and companies nationwide from overpriced, low-quality healthcare. Using industry-leading objective price and quality data and claims-driven ROI reporting, Bluebook's intuitive online healthcare shopping solution provides over 8,000 employers and their members with an easy-to-use benefit solution that increases movement from low-value to high-value care, driving savings and rapid ROI, and provides greater price predictability. Combined with a proven engagement methodology, Bluebook's innovative suite of services empowers employees to become smarter healthcare shoppers while decreasing costs and improving healthcare outcomes. Learn more at healthcarebluebook.com. I'm Todd Wilkinson from Healthcare Bluebook, and I'll be introducing today's webinar. A few announcements before we start. At the bottom of your screen are multiple application engagement tools you can use. All of the engagement tools are resizable and movable, so feel free to move them around to get the most out of your desktop space. You can expand your slide area or maximize it to full screen by clicking on the arrows in the top right corner. If you have questions during the webcast, you can submit them through the Q&A engagement tool. Please know we do capture all questions. There are additional materials that are available in the resource list. We encourage you to download any resources or links that you may find useful. Finally, please do feel free to contact our presenters with any additional questions. We've included their information in the bio tool on the desktop. Now I'd like to introduce our speaker for today, Bill Kampine, healthcare economist and co-founder of Healthcare Bluebook. As SVP of Analytics and Innovation, Bill has been heavily involved in the formulation process of the rules, both on a national and state level. Today, Bill will discuss his take on how price transparency measures are reshaping the industry and consumer experience, and how Healthcare Bluebook can help your clients stay ahead of these changes in the future. Now I'd like to turn things over to Bill.
Thanks, Todd, for that introduction, and thanks everybody for joining us today. I think we've got a great session, really exciting period. Past couple of months have seen some significant new programs, at least on a federal level, related to transparency, and we'll spend a little bit of time talking about the history today of those transparency rules. Cover the final rule requirements and some timelines for implementation. We'll spend some time talking a little bit about what we're doing at Bluebook to ensure that our customers are compliant with the new rules. We'll spend some time on the potential enforcement and other potential changes that could happen in the timeline as we look forward. And then if we have some time at the end, we'll spend a few minutes on a demo and be happy to answer some questions. So let's just start a little bit with our history. Pretty interesting. I've been involved at a state and a federal level, presenting and spending time with legislators and staff since about 2017. Really in 2018, spent quite a bit of time at a federal level talking to staffs and even had an opportunity to testify to the Senate Health Committee, and in 2019 began being invited to some conversations with senior administrators and policy advisors for the then Trump administration, and providing some feedback on plans to begin to think about transparency rules and implementation. I think I was as surprised as anybody with the depth of the draft rules that came out in November of 19. And like many other organizations in the first quarter of 2020, we certainly provided detailed feedback and commentary on the rules. A lot of commentary on these rules. Over 25,000 comments logged, and a lot of time and effort put into that. By the second quarter, at Bluebook at least, we really went through the draft rules and started documenting the requirements. I think we had a strong sense that this was a policy priority, and we really wanted to get an early start in it. And, of course, obviously COVID hit and things slowed down, but at least in the conversations that I was having with administrators and staffs and other policy groups in Washington, it was pretty clear that the transparency rules were still a high priority for the administration, and as soon as the situation had become a little bit more under control, the administration would return to those rules and likely issue the final rules. And so by the third quarter, I think, we were really in a development mind frame. We have a large federal client that came to us and wanted to make some changes in their transparency program, and they had received guidance, proactive guidance from OPM, Office of Personnel Management, to begin incorporating some of the draft requirements from the draft rules into any transparency implementation that they were working on. And so really, by, I would say, midway through 2020, we really began in earnest doing some development and testing for what I would say is sort of a V1.0 release that incorporated some of the new requirements into a version of the Bluebook site, and we began testing that in a release with our customer this past January. So, from my perspective, I feel like we've spent a lot of time thinking about it and documenting, and a little bit ahead of the game in terms of development and testing on the requirement side, at least for the consumer tool. And of course, in the final quarter of the year, the final rules were released. For us, I think we went back and went through the requirements and began yet another round of planning and road mapping, and sort of incorporating this into our development cycle as we look forward through the rest of this year and into next year. Similarly, we've also been having a lot of conversations in the past quarter and into the new year with our employer clients as well as our TPA partners, and making sure that they're aware of the rules and the requirements, and beginning to work together to ensure that they're compliant with the timeline. Just a little bit continuing on the overview with regard to the federal transparency rules. The underlying statutory authority for the rules is really the ACA, the Affordable Care Act, and under the Affordable Care Act, there is a very clear language that provides the Secretary of HHS with the power to compel commercial plans to provide certain types of information to consumers, and so this sort of falls within that rubric. In terms of applicability, the rules are applicable to all self-funded group health plans, the non-grandfathered plans, as well as health insurance issuers in the individual and group markets, and all self-insured employers. Interestingly, not covered are independent TPAs and service providers. However, in my various conversations with the rule makers, they had certainly contemplated that, for example, TPAs would take point in terms of working with their self-insured employers to provide services to ensure that they are in compliance with the rule set. Let's flip forward and talk just a little bit about the actual components of the transparency rules. The first one is the requirement to provide a consumer-friendly online tool that allows members to search by code or common term or even by their provider and receive in return provider-specific negotiated prices, an out-of-pocket estimate, and accumulator balances, among other content requirements. The content within that tool has to cover in-network, out-of-network, and pharmacy prices. Interestingly, there's no quality requirement in the tool, although that is something at Bluebook that is really key to what we do for our clients, both price and quality, but that is not actually a requirement as part of the final rules. When I think about the consumer tool piece of it, at least for our clients, I want them to feel secure. I don't want them to worry about compliance with this piece of it. At Bluebook, we'll ensure that our tools are compliant with the rules, and this is very straightforward to us. As I said, we're already in the process of documenting those requirements and developing the code, and we are well ahead of the game on this particular piece of the requirements. The second piece is the publication of public rate files. And so each issuer or group plan must publish 3 public files, and those include an in-network rate file, so fairly straightforward. The planner ID the provider IDs, medical codes, place of services, and the negotiated rate for each service. The prices have to be comprehensive. So if there's a provider under contract, and even if you haven't processed a claim for that provider, a price still must be provided. And those have to be updated on a regular basis, and they must be accurate as of the last date of the current contract in force. The second file is the out-of-network file, similar identifiers, plus the bill charge and the allowed amount. And the allowed amount could either be calculated as the max allowed that you pay to out-of-network providers, or alternatively, it could be generated from historical claims. And there are, obviously some limitations on those claims. I think it's 20 observations per provider per service for that out-of-network file. And then the third file is the pharmacy file. So pharmacy identifier, NDC, the negotiated rate or the counter price under contract. And interestingly, it also requires the entities to apply historic discounts to those to the actual counter prices and publish a net discounted price after rebate. And so very interesting requirement. And that was new. That was actually not in the draft rules. That was included in the final rule set. The final requirement here is the shared savings credit towards the MLR. This really applies to the plans. This is an incentive to encourage issuers to offer a shared savings incentive program, so programs that would be very similar to Bluebook's market-leading or industry-leading incentive program. This particular rule has actually, I believe it's already in effect. So if a plan in plan year 2020 was actually offering a shared savings incentive in 2021, when they do their reporting, they can credit any dollars paid to the member as an incentive towards their MLR requirement. Let's take a few minutes and talk just a little bit about the implementation timeline. So this is phased, and the phase here is really deliberate, right? The first phase requires the issuers and group plans to publish the rate files beginning January 1st, 2022, so less than a year away. The second phase is the implementation of the consumer-friendly tool populated with 500 services. So for example, those services are published as part of the final rule set in the commentary. The vast majority of those services, for example, at Bluebook, we already support within our tool, and as I said earlier, we will be well ahead of the game in terms of being compliant with these requirements, well ahead of the deadline of January 1st, 2023. The third phase is on January 21st, 2024. The plans must make available all prices for all providers and all services on that consumer tool. I think the way I think about this is a long ways out. So we'll see sort of what happens between now and 2024 in terms of any potential changes to the rules, or perhaps even a reduction in requirements. So I think that one's just a little further out, and I think a lot could happen between now and the implementation deadline for that. And as I said earlier, the MLR shared savings incentive is already in place. I'm asked frequently about enforcement. And so on the enforcement side, this is the same framework for all services under the ACA. And so that's the penalty is $100 a day per violation per affected participant. So these could be very, very significant potentially penalties. However, the rules do have good faith allowances. And so those good faith allowances include allowances for data error or omission, as long as those errors are corrected in a reasonable amount of time. There's a good faith allowance for temporary website disruption. And interestingly as well, for relying on third-party information in good faith. I know there were quite a few organizations, including American Benefits Council, that lobbied very hard for a safe harbor provision to be included in the final rule. So in other words, for a self-insured employer, if they made every effort but could not be compliant because of third parties, that they would be held harmless. The final rules declined to put in a full safe harbor, although these good faith allowances do cover, I think, some of those circumstances. This is a very complex rule, and there are a lot of layers to it. So my instinct here is I would not look near term for a lot of enforcement on this. That's just sort of my instinct, and probably some consensus I've had in terms of conversations that I've had with policy folks in Washington. I think there'll probably be a grace period as this is implemented, because, as I said, it is fairly complex. Just stepping back and from our perspective at Bluebook, thinking about work in progress, I think some very important elements here. The first is understanding data sources and requirements, and that would be both for the public files as well as the data that would be used by tables that would drive the consumer tool. And so important for us, we are in active conversations with our clients, with our TPAs, with the underlying network originators, right? So the network originator could be a carrier that provides a network, for example, that's used by a TPA, or it could be a non-carrier network originator that also provides network coverage for, say, a slice of the population. And so I think right now we are working with our clients and partners to understand the timing and what will be available in those data files. Obviously very important. We have that first requirement looming out there, January 1st of 2022, in terms of publishing the rate file. So a lot of active discussion there. The second piece would be data transmission options. And so the site requires accumulator balances, and not just traditional financial accumulator balances, but there are some additional requirements. So for example, for services that may have a service limit, so just say behavioral health, for example, you may be limited to 24 sessions on an annual basis. The requirement is when information is provided about that service, both a price, a provider, and an out-of-pocket estimate, you also need to indicate that this is a service that is subject to an annual limitation, as well as to provide a balance or an accumulator in terms of where you are against that balance. So understanding and working with those data transmission options is a big piece of this. Developing and testing compliance and that our platform is compliant with all the required capabilities. Obviously super active there. We have ongoing work, and as I said, we've documented all the requirements. We're looking at how those fold into our development schedule for the coming year, and actively working there. And this last one, and before I go into this, I believe my colleague Tim Johnson is also on the call, and I'm going to invite Tim to weigh in here. But this last part, is really thinking not in the narrow context of a compliance platform, but thinking more broadly in terms of providing differentiated information and services that really enable employers to ensure that patients are using high quality, cost effective providers in the network. And I'm going to invite Tim just to talk a little bit about what he's hearing in the market and the context for which, we are thinking certainly far more broadly than just a compliance platform.
Yeah, thanks, Bill. I'm happy to weigh in, and I think everything you said to this point has the great part about it is it has ignited a lot of discussion in the market that was already, frankly, very focused on value. Value-based care has been something that employers have been chasing. I think the market has been talking about, and it manifests itself in a lot of different ways. But transparency on cost is one piece, and then the quality side of this is huge, and we've made incredible strides. For every bit of transparency and the forward-thinking nature of these rules and how much it advances us to put data in consumers' hands on the cost side, the quality side has grown tremendously, and we sit in a place today where we can understand what the performance looks like of a specific doctor for a specific procedure and also understand the outcomes associated with patient experiences in the facility where the procedure is performed. And so as we think about how far data science has come and the things we can understand when we look at data, what we found in the market is there's more of a focus than ever on not just getting the data in people's hands, but more importantly, how do we create a salient view for consumers so they can truly understand it? What are the strategies we need to put alongside it so that it's simple for people? They know what information is available, when they need it. We can engage them properly. We can support them, with human beings and concierge support in instances where that's necessary. So the exciting piece, to me, as I look at the conversations that are taking place in the market, is the continued emphasis on transparency as a whole of cost and quality, and then driving strategies that are truly going to result in better outcomes, peace of mind for people as they enter the healthcare system, and certainly driving more efficiency for both the member and at a plan level on cost, whether that's because the procedures are being performed at a more cost-effective provider, or it may be that the quality associated with that outcome is going to avoid other downstream costs. So my experience has been, we continue to see that there are folks that really want to solve this problem, and I think the transparency rules and all the elements that within it are simply acting as a mechanism to bring more light to this topic on a broader level.
Yeah, I agree, Tim. I think that's right. And again, just to put a bow on it, the way that we think about this from a design standpoint is how do we retain all of the great navigation capabilities that we've developed, right? The simple color coding and the intuitive interface and the other support programs that we have in place, including incentives, that quality piece, right? I don't want the question of understanding quality in my network, trying to understand how we get our members to cost and quality. It's been such an important part of the conversation that we've had with employers over the past 2 years, even longer, to get lost in a very narrow view of compliance. And so really the question then becomes, how do you retain that important navigation and all of those components and make sure at the same time that we layer in the elements that are required by the rule set? So if you go down the list, you're ensured that you're checking off all of the compliance requirements, but without sacrificing any of the efficiency of the navigation or the insights or the incredible things that we can do in order to get members where they need to be. Let's talk a little bit about any potential changes to the requirements and to the timing. And so, again, the first thing is that, the ACA is still at risk in the Supreme Court, and I think the case is California v. Texas. The statutory authority for these rules is the ACA. If the ACA goes away, then so do the rules and all the requirements. And so I think that's still very much an open question. Naturally, we've had some changes in the Supreme Court. So it's, there's still some open questions there. The second is, there's no court challenge has been filed yet to date to the final rules. And I'll contrast that to the the final hospital rules that came out in 2019. Not long after the final rules were issued, the Hospital Association was in court challenging those rules. They lost in federal court and then appealed and lost again in December. And those rules went into effect on January 1st of 2021. We haven't seen any court challenge. And now we're sort of in the area of editorial, but again, based on the conversations that I've had with policy folks in Washington, there seems to be a general consensus that if we think about the requirements in terms of the consumer tool, any challenge to the requirement of the consumer tool is likely to be upheld. I think the general consensus, at least that I've heard, is that the ACA is fairly clear It's empowering, again, the Secretary of Health and Human Services to compel commercial plans to provide certain types of information, particularly to consumers. And it's a fairly clear, argument that this would be covered. The one that I think, just again, from conversations that may be a little bit more challenging, if only because I think it requires a little bit more mental gymnastics to interpret how the ACA could be read to compel plans to actually publish those rate files. There was more question as to whether a challenge to the rate file would survive in court. But to date, we haven't seen a challenge, and any challenge could certainly alter the timelines here. Third, and I think obviously most importantly, is that we have a new administration in the Biden administration. Once again, I think the general consensus is that it is extremely unlikely that the Biden administration would repeal these rules. I just don't think that's politically tenable. However, there are alternatives to modification of the rule. So, for example, timelines could be moved. They could be pushed out. Or alternatively, timelines could be moved and the requirements could be diminished. And so, for example, one way of altering the requirements could be, do all services need to be published in the public rate files or only a portion? So I think we're still a little early. Obviously the department heads have just been appointed or are still being appointed. And fairly clear that the administration's priority right now is vaccines and vaccine distribution. Nonetheless, at least at Bluebook, we continue to monitor very closely the implementation guidance, providing commentary there where it makes sense, and then continuing to monitor activity and any changes or I think decisions that could impact the timelines or the requirements. We just added this slide. This is not related to the payer rules, but however, on December 27th, HR 133, the Consolidated Appropriations Act that extended COVID relief was passed into law. And again, this is very interesting in that within HR 133, in Section BB, there was quite a bit of the language, or at least the original draft language, that was part of the 2019 Lower Healthcare Costs Act, the bipartisan act, or the bipartisan bill that came out of the Senate Health Committee. Many of these provisions were just actually passed into law in December, and they also create some new requirements. And, I think the one that most folks will recognize here is the elimination of surprise billing. So if a member is not informed beforehand and inadvertently selects an in-network hospital, and on that day they had their procedure and that hospital was using an out-of-network local tenens anesthesiologist, that anesthesiologist historically could bill the member or balance bill the member, and you could end up with a bill for $3,000 for anesthesia that should have cost $300. The new law reduces that liability for the patient down to what the in-network rate would have been, and provides a process for the plan to determine the payment to the out-of-network provider. But in addition to that, there are a number of other provisions in Title I that includes a pre-care EOB. So up to 3 days prior to having a procedure, a member should be able to get a price estimate and an out-of-pocket estimate. Of course, this requirement is very, very similar to the requirements of the transparency rule set. The timing here is a little bit off. So the pre-care EOB, I believe the effective date is 1/1/22, whereas the similar information that is required in the member-facing portal for the transparency rules is 1/1/23. And so my guess here is we'll probably have some regulatory reconciliation of these two rules so that the timing begins to align. But it's just, something to be aware of. That's out there. And there are other provisions, including accuracy of provider directories and implications for the members' out-of-pocket cost. And in Title II, there are some additional, I think, very interesting elements. Again, much of this taken from the Lower Healthcare Costs Act. One of them is looking forward, a prohibition on gag clauses in contracts between insurers and the providers. So in other words, the contract can't forbid the insurer from showing price information ultimately to consumers. I think it's a huge win. The other aspect of that is a requirement of payers to provide unredacted claims data to their self-insured employers. And again, I think that's a huge win. I think from our perspective, very difficult to manage what you can't measure. And if you can't receive your claims data, difficult to understand what's going on in your network and build benefit designs and programs to support your members. So I do, for employers, I believe this is a really big win. Again, we're continuing to go through and document the requirements of the various sections within the No Surprises Act so that we can incorporate that in our work plans, both with our self-insured employer clients as well as our TPA partners. So before we jump just into a demo, let's think a little bit about looking ahead. And so, as we talked a little bit earlier, we view this as really a huge opportunity for employers to have better steerage programs and enhance their programs on both a cost and a quality side. We're sort of in this period where we're about to have access to an incredible amount of price data. And, of course, on our side, we also have the quality data. And this is a huge opportunity for employers to put in place improved steerage programs and make better use of their networks and deliver higher value care. I'm going to ask Tim again to weigh in just, on this part in terms of the conversations we're having and work we're doing both with brokers and our consultant partners to just get the next layer deep in the requirements and to, again, work with employers on their options and things that they can accomplish.
Yeah, thanks, Bill. As we look forward, we will be very focused, as is, I think, more broadly within the space. I'm sure everybody, will find this, but we're looking carefully at how can we take all this information, put it into an analytical framework to think about the impact that's possible if you make sure to develop the right strategy around it. And we are, as a business, are participating in that in a number of different ways. And I think that as a whole, I think the industry is moving toward utilization of this data in support of helping the consumer and the member. And some of the things that I would reference as more tangible strategies that we see moving forward and taking shape and getting better and better as we get more transparency and more data in folks' hands is things like evolving navigation solutions to leverage cost and quality data as part of the core mechanisms for supporting members and where they go within the healthcare delivery system, and having detailed data down to the doctor, the facility, across cost and quality, and being able to support people in that way. We see it manifest in other ways too. If you think about plan level strategies, centers of excellence that are formed truly on performance and cost metrics, that are out in the open and understood. Alternate network strategies continue to be a common theme, whether that means high-performing networks, clinically integrated networks. There's a lot of innovation happening in that area. Certainly we see, reference-based pricing continues to be something that companies are looking at. And there's opportunities in all of this to think about how do you put information relative to cost and quality side by side to aid in that. There's one other I'd mention, which is in the provider space. If we think about on-site and near-site clinics, we think about how do referrals actually happen at a clinical level. The underlying data is key to the literacy around all of this and putting both the member and entities that are serving the member in a position to be able to support driving to the best value. And so those are some of the things that that we've been spending quite a bit of time, with clients, with the brokerage and consulting community, and others, talking about. And I see all of those things continuing to get better, and we'll continue to see innovation as more and more data comes to the surface. That'd be exciting to see where we go.
Yeah, great. I agree with all those points. And in addition to the enhanced steerage and network strategies, just looking internally, again, and I'd mentioned this earlier, but we, will continue with our roadmap and planning to implement all of the requirements for the transparency rules. And, that's a process of development, testing on the standard release schedule. We will also continue to monitor those policy changes and any guidance from the new administrators or the other departments. And then finally, and we had just touched on it on the last slide just a little bit, but getting a little bit deeper into the next layers of the No Surprises Act. There's a number of folks that I've been having conversations with again in Washington, and they're still awaiting some regulatory guidance in terms of timing. And the Title I of the No Surprises Act, it has a clear implementation dates in Title II with respect to the gag clauses and a number of other items. That the implementation date was not listed discreetly, which generally means it goes into effect as soon as the law is passed. Still some questions on that, so stay tuned. We may have a subsequent session dedicated just to the requirements of the No Surprises Act as we get a little bit more information about that into the next quarter. And so at this time, I think what I'd like to do is just share a brief Bluebook demo. This is a demo to reflect some of the requirements and how those requirements fold into the Healthcare Bluebook user experience and how we're beginning to think about incorporating some of those requirements. I think it's kind of interesting because, there are a few things that are a little bit different from the way in which we historically have looked at these items. And let me share my screen. And Tim, I'm going to ask you, can you see my the Bluebook homepage?
I do see it. Yep.
Great. Perfect. Yeah. So now we're in the right place. So this is, again, the classic Bluebook homepage. The requirements for searching under the new rules are that you have to be able to look up services by a common term. You have to be able to look up providers. You have to be able to look up the individual codes. All of this, incidentally, is already supported by Bluebook. We've just brought some of these features out in a demo environment just to make it a little bit more clear. We'll choose a very simple procedure, tonsillectomy. Very easy. You could enter in 42826 in this, the little green dot there. In this instance, always indicates that that is a rewardable procedure in the Bluebook shared savings. So we'll go ahead and we'll take a look at that. Great. And so we get our result for tonsillectomy. And so the requirement is to present the information about the service, a easy to understand definition of the service and the CPT code. And what we really want to retain at Bluebook is the classic color slider bar. And we do this at an episode level. So this is everything related to the tonsillectomy. And so for this member, in their network, in the area where they live, the total cost for this service is going to be between roughly $1,700 on the low end and as much as $9,000 on the upper end. And the fair price that they would be shooting for is about $3,600. And of course, we do break that down individually by the facility fair price, the physician fair price, and the anesthesia. The facility, historically being the most important decision here because it will be the largest portion of the cost and it will also have the highest amount of variability. Now, what's a little bit different as we come down the screen Again, we default first to facilities because, again, that's the most significant portion of the cost. But the requirements are we have to present the facilities, all the facilities that offer this service, and so there's a long list here, and present them by distance, sortable, by their actual cost, right? So the negotiated fee for this facility for a tonsillectomy, Evergreen Medical, is roughly $1,200. And the member out-of-pocket estimate alongside of it, this member hasn't used any of their accumulator yet, so they also have to pay roughly $1,200 out of pocket. And of course, we want to retain the reward. So if you use a green provider here, like Evergreen, the member can earn a $100 reward, as well as additional information and a map. You can increase the distance or decrease it just for convenience. And so the next thing we'll do is we'll actually click on Evergreen, and we'll begin to build an episode here. And so you notice there's sort of a shopping cart. We've got the information about the tonsillectomy. We've got Evergreen, their discrete price of $1,223. They are eligible, or the member is eligible for a reward at this facility. And then as we come down the page, we can see information about this particular member's accumulator balances, their deductible, the family deductible, the out-of-pocket max. This member hasn't used any of their out-of-pocket yet. And so we also have Evergreen Medical and their estimated out-of-pocket, which is essentially the price at $1,223. And then we can come down a little bit further and we can select a doctor that works and performs this procedure at the Evergreen facility. And so we have a list of providers here. We have the in-network negotiated price that this doctor gets paid for performing the tonsillectomy. That's $429. And again, because the member hasn't used any of their out-of-pocket, they'd have to cover that whole portion of it. If we click on the doctor, we then continue to build this episode. So we have the facility price, the reward information, and we have the doctor, and we have the doctor's price as well. And if we begin to scan down the screen, you can see that we begin to complete this episode of care. Again, we have the accumulator balances, and we have Evergreen, their price. We have Dr. Wiener and his price, and we have a grand total estimated out-of-pocket for this service at this provider of $1,652. And what's great about that is we can then look at this on an episode basis, right? Rather than just looking up the doctor and finding the price and the risk here, right, and the requirements for the transparency rules, as a patient might just look up the doctor and fail to look up the facility and later on get a bill for the facility and be really surprised about it. We like to retain the total episode cost and make sure that we walk the member through each stage to get the price and the out-of-pocket accumulator at each stage. Going all the way back to the original tonsillectomy results, if the user would like, they could simply select the doctor and get a list of all the in-network doctors that perform tonsillectomy and their price and your out-of-pocket estimate if you were to use that doctor. And if you start with the doctor, you can do the same thing we did by starting with the facility. We can click on the doctor, and again, we can begin to build this episode, and we can come down the page, again, see the accumulator balances, and select one of the two facilities where this doctor works. And we would choose the less expensive facility. We're going to click on that. And once again, in the same way, it doesn't matter if you go through the facility door or the physician door or how you look it up within the system. It enables the member to get exact prices for facilities or doctors for services and get a full, complete picture of the total cost, as well as understand where that facility, where that episode falls on a color basis with respect to all other alternatives that are available in the network. So this is a way of retaining all of the great navigation capabilities, but layering in some of the discrete requirements about exact prices, out-of-pocket costs, and accumulators as required by the rule set.
All right, we are just about out of time. Thank you so much for joining us today. Big thanks especially to Bill and Tim and to Healthcare Bluebook for making today's session possible. Hope everyone has a great day. Thank you for attending, and this now concludes today's session.